Thyroidectomy. First and foremost, let us find out what will be the meaning of thyroid. The thyroid gland. That thyroid gland is like a butterfly shaped gland in front of our neck. You see your neck? That thyroid gland is like a butterfly shape. It sits right in front of your neck. The purpose and the work of this thyroid gland is to produce hormones. This thyroid gland produces hormone that regulates your hormones. I mean your metabolism, growth, and development. So this thyroid gland does a lot of things in our body, and is part of the endocrine system. That one another story, another talk for another day. So this thyroid gland, like I said, it plays so many roles, so many functions in our body. And this thyroid, it is either is too high, which is called hyperthyroidism, or too low, which becomes hypothyroidism. When it's too high, it becomes overreactive. When it's low, that is when people put on weight. And when it's too high, that is when you begin to lose weight. But before I continue, I just want to throw this in because there's so much news about Mercy Josie weight loss, Mercy Josie they suck BLOOD, Mercy Josie they do this, Mercy Josie they do that. I like Mercy Josie as a person. I like her heart. I like her because she did act well, but I don't like the character where she display taking another woman's husband. I don't like that. I go talk my own. Now my own I talk, you can come for me. I don't care. I have been saying it for years. Even when the whole saga was going on, I said it. Go marry your own. Mercy Josie, you fine. Where were that time? I don't know why you got yourself involved with somebody else's husband. But that's not why we're here. I'm here to tell us a little bit of what I know about these thyroid issues that she told us. Mercy Josie came on social media a couple of years ago and told us that she had a cancer scare. That she did some tests where she was in the US and she found out that she had issues with her thyroid gland. And she had to undergo emergency surgery. That surgery that Mercy Josie undergo is called thyroidectomy. That thyroidectomy, it is either they will remove part of the thyroid gland or they will remove everything. Either way, she will have to be on medication, which she told us that we have to be on medication for the rest of her life, which is not a big deal. I see the people say, take medication for the rest of your life. It's not a big deal. People that take high blood pressure medication, you yourself, you're on medication for the rest of your life. Except your high blood pressure is cured. You that take Tylenol or paracetamol or Panadol for your headache, you are on medication for the rest of your life. So stop mocking people that are taking medication for a particular ailment in their body that help them to produce certain hormones, like this thyroid gland that she removed, that she told us that she removed. Another thing when I want to talk for this matter is that this thing, and like I said before, this thyroid has two, one hyper and the second one hypo. The thyroid gland, like I said, produces so many functions, depend on what they do in the body. I don't list a few things whether they produce the hormones that they produce in the body. Like I said, the hypothyroidism, one is low. It can make you to be so weak, tired, weight gain. You could get cold all the time. While the hyper, the one that is the hyper, which is low, which is high. I don't know why I keep saying low. Hyper, low. Oh, Jesus. Hyper, high. Not hypo. Hypo is the low. Hyper is the high. So the hyper is when the thyroid produces too many hormones. And when it don't produce too many hormones, then you go come they lose weight. Those people will have heat, enough heat, intolerance of heat. Like you go say, oh, my body, inside my body, they hot. And your heart rate, your heartbeat will increase, and so many other things. Even this was where when Mercy Josie told us that she had that cancer scare. She don't get cancer. Oh. She did not say she have cancer. She said she had that cancer scare because of the test that she did. Because this thyroid disorder, this thyroid can cause other disorders. Like that gut here, that thing where they do your neck, it go they big, you will get lumps, and of course the cancer, thyroid cancer, that is if they find out that you have that. And majority of the things that you do is either you're on medication, the treatment, or once you are diagnosed, or you will do surgery to remove the gland, to remove the gut here, to remove, so many other things that maybe if it's cancer, they will take off that part of the gland that the tumor is through surgery or through other therapies. So with Mercy Josie, for her to come tell us now that she did have surgery done, which is called thyroidectomy, that is the surgery that we allege that she did, because she told us she did thyroid surgery. So that surgery is known as thyroidectomy. Like I said before, like that surgery involves like removing either all of that thyroid gland to correct the overactive state. That is, if it is hyper, if it's too high, they will remove that part of the tumor in that thyroid gland to correct that overactive state. Then if it is hypo also, they also still the same thyroidectomy. They remove that part of the gland that is not functioning, which can cause, the goutia or enlarged nodules in which is goutia in that region of your throat. They would not, it's either they remove it or they do what is called total thyroidectomy, which is they remove the entire thyroid gland, which that person will have to be in medication or therapy for the rest of their life. So the part that me and they allegedly thinking that Mercy Josie did probably is the hyper. That means she has very high, thyroid is functioning very high. So if you have a thyroid that is functioning very high, that means it could be that is part of the reason why she's losing weight. If she did have a surgery, a thyroidectomy, and now she's, because our thyroids, they overfunction, they overwork. That is why, like if it's here in the US, she's supposed to be doing this test every 3 months just to maintain, to help her regulate her medication where she did take. That thyroid medication where she did take, to help her know if she's taking too high dose or too low dose. I'm just saying this. Is not that I know that what she's going through right now is hyperthyroidism. I'm not saying that's what she's going through. I'm just speculating that it could be the reason why she's losing this weight drastically. Because according to people with such a disease or ailment or diagnosis, if you have hyper, that your thyroid they overactive, they are in such high that they act so high. The main thing, number one thing, is weight loss. Weight loss. When you are not planning on losing weight, you will just be losing weight drastically. So, like I said, I don't know what Mercy Josie is going through. There are so many other things that can happen. I'm just going to stop here, and I'm just going to assume that probably, because a lot of people have been speculating in the first video that I made. A lot of people are speculating, that she do this, she do that, or she no do this. It's thyroid surgery. People do that all the time because they take medication. Some people take medication to correct it if the medication can correct it. Some people have to do this surgery and they are fine. They are fine. So we really don't know what part of our thyroid is not functioning, or what was found, that was removed. If it was everything, that gland that is shaped like a butterfly that is removed from her neck, whether it's partial or the entire gland is taken out, we don't know. This is the reason why Mercy Josie need to come out and speak. As a celebrity, you owe that to your fans. You owe that to the public. This, you cannot be hiding under weight loss. Say you are hiding under weight loss to say, oh, now weight. This kind of weight, no, you cannot lose weight like this now. It has to do with something. It has to do with an ailment that has gone beyond your control, that you cannot control anymore. So you need to come out and tell Nigerians. You can come out and tell Nigerians, say, okay, when I'm ready, I will talk to you. Instead of allowing people and bloggers to speculate, to keep speculating. Saying that this happened to you and that happened to you. So to me, this is the area that I can relate this weight loss to, because she had told us in the past that she get issues with her thyroid. Please share this video. Share this video and subscribe to my channel. My name is Patience, and this is Patience Vlogs, VLOGS TV. Please share, and subscribe and follow me. God bless you.